I want to cover a couple different points today. First I want to talk about what kinds of symptoms are people going to see when they have Lyme. I want to talk about what do you do when you get a tick bite. I want to talk about what can you do to help people that you love that have Lyme. And I'm going to talk about what makes it so hard to get over Lyme. So my mantra that I use to sort of encompass the symptoms that will be seen in people who have Lyme is pain, brain, and lame. So we see people who have nerve pain, joint pain, muscle pain, any kinds of pain. Brain will be things like cognitive impairment, brain fog, people that have central nervous system problems like multiple sclerosis, Lou Gehrig's, Parkinson's, dementia, Alzheimer's. It can also include things like vertigo and tinnitus, because some of the people with Lyme have that. Then lame includes people who have chronic fatigue, which is something that virtually everybody with Lyme has serious problems with. And lame also encompasses the people that have rheumatoid arthritis and joint pain. So when somebody has unexplained symptoms that nobody can diagnose, and they go from doctor to doctor to doctor, and they've got pain, brain, and lame, think about Lyme. And the problem is that if you go to your doctor and you say that, I think I could have Lyme, the doctors are already indoctrinated that there's no Lyme in Florida. So, they're not really very interested in getting, testing done for it, and they typically do just an ELISA test that's a screen. And most people with Lyme will be missed when that test is done. So the right test to do is a Western blot. And sometimes even the Western blot won't be positive. So it's important to go farther than that. If somebody still has symptoms consistent with it, oftentimes we will treat and retest, and those people will not uncommonly come back positive. I was just listening to YouTube and Dr. Alan McDonald the other night, and he said that there are as many as 100 different strains of Lyme, and one strain was the one that was used to determine which antibodies they would use for the test kits in the United States to test for Lyme. So it's not at all uncommon for people to have Lyme, but they don't test positive. So it's more important to treat, and then there are other ancillary tests that can be done, like something called a CD57 count or a C4A. So it's important that people be knowledgeable about what could constitute Lyme, because most of the time, even if people are CDC positive, if according to the CDC's criteria they have Lyme, their doctor most of the time will tell them it's a false positive, and they keep on having problems and they're still sick. So pain, brain, and lame, that's for the diagnosis. What do you do if you get a tick bite? So, the standard treatment is doxycycline, but it's been well documented that doxycycline drives Lyme into the cyst form. So doxycycline, in my opinion, all by itself is inadequate treatment. It needs to be combined with a cyst buster. So I typically use doxycycline with metronidazole, or my favorite, tinidazole, and that treatment needs to be for a month. And just to kind of round out the information about ticks, when you go out in the woods, when you go someplace where you can have exposure to a tick bite, you want to tuck your pants into your socks, and you want to make sure you wear light colored clothing. And I've got patients that have had multiple tick bites that even put duct tape at their wrists and their waistbands and at their pant lines. And using something like DEET is a good thing for tick prevention. And then it's important to check for ticks afterwards. Ticks actually get on from below and climb up, so you want to check any place that ticks can have been exposed and climb up from. So the next thing that I want to cover is, why is it that Lyme is so difficult to treat, and why is it that it's so hard for people to get over Lyme? There are a lot of reasons why this is true. When someone gets a tick bite, ticks are like nature's dirty needle, and there can be as many as 100 different kinds of organisms that can be transmitted from the bite of a tick. So you can have everything from Lyme, Babesia, Bartonella, Q fever, Rocky Mountain spotted fever, tularemia, Powassan virus, parasites, Heartland virus, Mycoplasma chlamydia. There are all kinds of infections that people can contract from the bite of a tick, so that when they get Lyme, they don't just get Lyme. They get a whole host of microbial infections. Then Lyme is sort of the forerunner that kind of sets the stage to maintain chronic infections. Lyme and its co-infections know how to maintain a stealth infection. You know, when they discovered a man up in the Swiss Alps that was 5,000 years old in the ice, they sequenced his DNA and he had Lyme. The Lyme sequence was in his DNA, so we know that Lyme has been around for 5,000 years. It knows how to maintain a chronic infection. When you have something like a strep throat, it's a rapidly growing organism, and you quickly clear that infection with antibiotics because it's fast growing and the antibiotics hit it when it's growing. But when you have things like Lyme that have a growth cycle that's on the order of a week to several weeks, you have to hit it in growth cycles, so you can't do a week of antibiotics and get rid of Lyme. You have to hit it in growth cycles, so it's going to take a long time of treatment. So when someone gets that tick bite and they get multiple infections, the Lyme impairs the mitochondria, which are the little energy powerhouses in the cell. So it poisons your ability to produce energy. So people are tired and they don't have energy to do things, and they can't fund their immune system. Something else that Lyme does is that it shifts the immune system out of bacterial infection fighting mode into inflammatory mode. And then it also impairs immune memory, so that when people get Lyme, their immune system acts like it's never seen Lyme before. It doesn't have any memory of that. And it's not until people are on antibiotics that you start to regain that immune memory. There's also the ability of the Lyme organism to change its outer surface proteins. So if your immune system is able to get its number, it changes its number. So another reason is that you get multiple infections when you get Lyme. So you have an immune system that's compromised and that's underfunded, and then so it's like getting a pay cut and 10 new bills to pay. So there's just no way your immune system ever makes it out of the water unless you get some support and some treatment. So some of the common infections that you'll see with Lyme are Bartonella. With Bartonella, you tend to see problems like swollen lymph nodes, dotted, lacy red rashes. You will see problems with pain in the soles of the feet. And Bartonella also has the potential to cause nervous system irritability. So people will get funny twitches, jolts, and shocking pains, and they'll get irritability of the brain. So that can be anything from migraines to seizures to tinnitus to vertigo. So, you know, those kinds of things are what we look for some of the co-infections with Lyme. Babesia is the other most common co-infection. It's a malaria-like infection that is a parasite of red blood cells. So it tends to cause fever, sweats, and chills, just like you see with malaria. So that's something to look for. You know, that's another tip-off with Lyme. So Lyme is really difficult to eradicate because there are all these multiple infections to treat. People have a compromised immune system. Lyme also produces chemicals that impair the endocrine system across the board. And that's our way of having communication from cell to cell and from system to system. And if you've ever been in a complete power outage, or once I was in a hurricane and everything grinds to a halt if you have no communication. And so that's another reason why Lyme is so debilitating, because your whole endocrine system is out of whack. You know, the adrenals, the thyroid, the pituitary. So, you know, nothing works right. It's also common for people with Lyme to have heavy metal problems. They tend to be toxic waste dumps. They've accumulated lots and lots of toxins. You know, all the neurotoxins, other toxic compounds from the Lyme add to the load and impair the liver being able to clear things. So you can see why it's a very difficult thing. Lyme also knows how to hide. It hides inside cysts. It's been demonstrated that it converts from a spirochete form to a spherical cyst form, which is like an armored tank. So it's resistant to everything. So that cystic form is very difficult to get rid of. Lyme can also hide inside the cell. So what better place to hide than inside of your own body, in your own cells, where your immune system can't go after it. Lyme can also hide inside biofilms. Plaque in our mouth, that sticky gooey stuff, is a biofilm. And so Lyme and other infections cause biofilms to form, and you may need antibiotic concentrations 1,000 times higher in order to penetrate a biofilm. So you can see why sometimes antibiotics don't work, because they can't get through that biofilm. So you need things to break up biofilm. Lyme also, and its other co-infections, can induce clot formation. So people can have excess clotting tendency, and the bugs actually hide inside the clot. And then there's, of course, antibiotic resistance, which we all know about, and these bugs have that as a mechanism. So when they impair your immune system, they hide in cystic forms, biofilms, inside the cell, inside clot. Your immune system doesn't know to go after it, and it's creating a toxic waste system in your body. You can see why people have a hard time recovering. So it's important to address those things in treatment. You can see why a month of antibiotics is not going to cut it.